episode 4 of our Mission ICU Rural Healthcare series.
Hello.
Every month, hi Swapnil, we can hear
Hello.
you.
Hi, Sapul, we can hear you.
So
Yes, go ahead.
while Swapnil comes back, as I was saying, every month at Mission ICU, we have a conversation with either an innovator or a funder in the sphere of rural Indian healthcare. And the goal is to really understand how this ecosystem works, who the players are, and provide a platform to all of these different players to tell their story. And keeping in line with that, today we have with us the team of OxyCar. They are innovators in the sphere of rural healthcare, and we have Karan Bhanushali, Swapnil Shah, and Gitanjali Chaudhary. We're really excited to be in conversation with all of you and to learn more about OxyCar. So, without any further ado, please go ahead and introduce yourselves and tell us a little bit about OxyCar.
Sure. I'll go. Hi, I'm Karan Bhanushali. I'm an IIT Madras graduate from biotechnology. I did my master's in biomedical engineering, and post that I've been a researcher and an entrepreneur before. And especially when the COVID wave hit, we started this Project OxyCar. So like it was, as every startup goal, it was highly unplanned, and we caught up as time came, as the situation progressed. So we'll discuss about that, how we went about it, and I'll ask Gitanjali to introduce herself as another co-founder of this project.
Hi, thank you, Karan. Thank you, Lubiana. Hi, this is Gitanjali Chaudhary. I'm a computer graduate and I have done my engineering from College of Engineering, Ambejogai. And it's been 7 years I'm working in the various industries, I can say. I have worked in the IT sector, then I have worked in the renewable energy, and now we worked on some projects with Karan, and there with some issues, with some personal issues, which brought me here to work on the OxyCard. That really helped me and motivated me to get on this platform and do something on this. So that's it. So we'll explain slowly about the OxyCard, that one by one, like how it is and how we
Yes.
got into it.
So you can introduce yourself. That's a nice introduction, Gitanjali.
Thank you.
My name is Swapnil and I belong to Pune itself. I belong actually a lubricants background and I'm into and we actually met several times and we come together just for the social cause and to get benefit for the people. So what we can do better. So we always talking to share ideas and we always talk whenever we together we always talk on only one how can we contribute our society and that's
Wow.
Perfect. So we as a team and one missing member, an honorable mention, Darshan Mahajan. So this was the project I started with Darshan, and then with a common social cause, we all joined together from very diverse backgrounds. Everyone came together from very different backgrounds, so that was something quite unique about our team. So Darshan is again into social entrepreneurship. He runs his startup into artistic humans. He's into theaters and into Mission ICU. So he is doing his part of social work. So he couldn't join us due to some of personal reasons, I think. So that's another honorable mention. So we can proceed ahead with the talk.
Super. So thank you for introducing yourselves, and it's so nice to see that all of you all are so diverse in terms of education, in terms of places as well where you're from, and now you've come together for a common social cause. So I'd like to go ahead and ask you a little bit about OxyCar. So tell us about the OxyCar story.
Yes, so that's an interesting story actually. So we were right in the middle of second wave, and it was that time where the beds were running short, and panic was starting everywhere. So me and Darshan we met about an year ago in one of our startup competitions. We were we met in a boot camp networking session, and we kept in touch. So we were just chit chatting, and then this topic came up about what's going on in the country and what are all the solutions that are currently happening and how could we help. So one thing led to another. Like it was a 2 hour long call. We discussed about a lot of things. Then some examples came out, like when rickshawala in UP put an oxygen cylinder in his rickshaw and was giving support. And one thing led to another, and then we came at a conclusion that was like there are many hospitals. There's a lot of oxygen facility, but the interlap, which is the number of patient and the available oxygen, the interlap is hospital beds or the oxygen beds, and that is the bottleneck why patients are dying or are not able to get emergency care. So a lot of us lost our close relatives as well to this COVID-19. So then we decided like what solutions can be brought in which need not need much investment but can leverage already available infrastructures. So we kept discussing, and one thing led to another, and we arrived at a solution about why don't we convert available cars into an ambulance. An ambulance need not be a big van. All patient needs is an oxygen support, an Ola for oxygen, if we can say it that way, and a support so a patient can lie down without infecting a driver. So the thoughts again kept evolving, and then we bootstrapped like from our own pockets with bootstrapped and prototype. So this was the overview of how our OxyCar started. At that time, we were all busy in our professional works and other commitments, but that after 9 to 5 day, this is something we work towards to save lives.
Super. So would you like me to share the video right now about OxyCar?
Sure, sure. Go ahead, share the video.
So the OxyCar team has prepared this video especially for us in order to tell the OxyCar story a little better to give it that extra dimension. So I'm going to go ahead and play this video for the next few minutes.
Sure.
Here it goes.
Hello, I am Karan Bhanushali, a graduate of IIT Madras. So today we are living in an unprecedented times where second wave of COVID pandemic has hit India very hard. Everywhere there is shortage of beds. So data says there is one ambulance for 75,000 people. So such is the limited availability of ambulances in India, along with the limited hospital beds as well as the availability of oxygen, which are being sought. So we came up with a resolution that no one has to die because of unavailability of ambulance and these medical facilities in these emergency times. That's how an OxyCar was born. We, with the team of my co-entrepreneurs, Darshan Mahajan, have started this OxyCar. So what does this kit consist of? The kit consists of an inflatable car bed, which is run by a pump attaching to a car charger. The car bed covered with a rubber mat, covered with a mattress and a stretcher. So there is this foldable nylon stretcher, which can be helpful for the medical personnel. So this is one part. Second, we have a car shield and a PPE kit worn by a driver. Third part consists of an oxygen mask with an oxygen cylinder which will be placed in the front, a 10-liter ambulance oxygen cylinder, which can provide, depending on the usage, on an average support up to 10 hours. So this is the oxygen support, and other equipment such as first aid kit, UV sanitizer, diagnostic kit such as BP monitor, oximeter, thermometer. This all will be provided with the kit.
Here is an OxyCar kit. The number of things that we need to convert any car into an OxyCar, and I'm going to show you in how less than 15 minutes you can convert your car into an OxyCar. The first thing that you need to do is to fix the oxygen cylinder. Okay. So here is a portable oxygen cylinder along with the oxygen mask that you need to have. You can put this oxygen cylinder in the front seat, and this you can So we have installed the oxygen cylinder in the front seat, and you can see the oxygen mask is attached with the holder at the back seat, and we have pulled the pipe here. Installed the oxygen cylinder with the mask. Now we will be installing the car shield, which will be protecting the driver partner. So this is the car shield, and we will be opening it, and I will show you how easy it is. You can install it in less than 5 minutes. Now this is going to protect the patient's assistant as well as the driver. So now we have installed the oxygen cylinder mask as well as the car seat. The next step is to install the inflatable bed for the comfort of the patient. It will create a temporary comfort zone in the back seat of the car. This is the inflatable bed. How it looks. This is how it looks. And we have filled the air inside it through this air pump, which you can install, which you can connect with the car and do it. This is our bed. These are the pillows that comes along with this inflatable bed. This is for the additional comfort. I'm just keeping it here. This is a normal car first aid kit along with oximeter and thermometer for the patient's assistance. So I'm just installing it here, this side, here, and the oximeter in the back seat. Now you must be thinking that what if the one oxygen cylinder that we have in the front seat is completely utilized and the driver partner do not have the time to buy or purchase or refill the existing oxygen cylinder when there is too much of rush or too many emergencies. You can have additional oxygen cylinder kept in the boot of the car. In case of any unforeseen circumstances, any leakage, we strongly recommend to have a fire extinguisher. This is a UV sanitizer and a normal sanitizer which can be used after every ride. You can sanitize your car after every ride. The size can differ. The last but not the least, the mask and the PP kit. This is to protect our driver partners. You can use surgical mask or N5 mask, whichever you want, and can be kept. One part of the mask can be kept at the passenger seat and one part of the mask can be kept in the driver's seat.
As you can see, this is the inflatable bed supported by an inflatable support here. This is inflated by a pump which directly attaches from the car charger. It comes with the kit. Over that, we put a rubber mattress which will protect the bed from any fluids like blood, coughing, vomiting, any bodily fluids. Then here comes the bed sheet, which will also be a mattress, and this is a foldable stretcher on which the patient will lie, so it will be very easy for the medical personnel to carry the patient. The patient will be given privacy by the sunshades attached to the windows and also at the rear. Here, this is a car shield which comes with a velcro which is directly attached to the car ceiling, and a partition is created. For the patient's other safety, we have included a fire extinguisher cylinder here. As you can see, this is a fire extinguisher here. So patient, there will be an air conditioning inside. So the patient will lie like this with an oxygen supply, oxygen mask he will get with the supply the cable going from the front. A 10-liter oxygen cylinder will be placed in the front, and the patient will get a complete oxygen supply. To measure his oxygen levels, we are providing basic medical equipment, which is oximeter, blood pressure monitor, thermometer. We'll be also providing a small sanitizer bottle and an ultraviolet sanitizer, which sanitizes the car from inside. We also have a first aid kit, which goes right here. So this is how this all assembly costs less than 10,000 plus the oxygen supply we will ensure on your local level. This is how we'll be converting your or any car into an OxyCar with a rear part converted into an ambulance type structure that will give patient all the necessary support required.
We have a volunteer to understand how difficult or how easy it is to use the OxyCar. Considering the factors that the patient might need some assistance to wear the oxygen mask, we are trying to demonstrate how once the patient gets inside the car, the driver plays an important role to assist the patient. The oxygen level needs to be monitored as per the instructions by the doctors. These are things which needs to be consulted. These are things need to be operated post doctor's consultation. We are also trying to show what level of comfort is achieved once the patient gets inside the car and once the doors are closed. So you can see this is how semi-comfort. In less than 15 minutes, we have converted this car and created an alternative facility. In Tier 2, Tier 3 cities and rural areas, we need such support system. We need such facilities where we can help patients, people who are in dire need of help. OxyCar can be made operational wherever it is needed. All we need is to drive it through citizen participation. We hope to have your support and create this solution all across the country.
Hello, OxyCar team, and thank you for creating that wonderful demonstrative video for showing us exactly how the solution works. I think having it in video form was really a great tool to visualize it for the audience. So, thank you for putting that together. And my next question for you is, can you tell us a little about how you funded this project? So, you initially mentioned that it was bootstrapped, but how did you go ahead from there, and what are your future plans?
So yes, as I said, it was bootstrapped, and during the pandemic, peak of pandemic, we had couple of well wishers. One of Darshan's friend from Dubai and one of Gitanjali's friend. They gave a generous donation as much they could, about 20-30 thousand, I think, and that helped us really make the prototype and fine tune it with the patient requirements. So that's all. But currently, we are looking for funding to build a product. As you can see, this is just a prototype of how a system should work. So back then we were thinking just with the COVID-19 context and an oxygen. But as time progressed and COVID vanished and things are normalized now, we have a bigger vision, which is this solution which can make into makeshift ambulance, can provide support into any emergency medical situations. And now that is our vision shifted from COVID-19 crisis. And to achieve that, we need to develop a better product, and we have some product innovations in mind for which we are looking to raise some funding through charity, of course, or through goodwill. We are registered as a non-profit organization. So that's all about the funding.
Thank you for sharing, Karan. So you said that you had some product innovations in mind. Would you like to share that with our audience, just whatever stage it's at? I think it would be great, just in case there's people in the audience who would be interested.
Well, it's still at the ideation stage. We are ideation and design stage. We are figuring out what materials to use. So what we are putting together is what we saw as an inflatable bed. So half of the equipments are imported from China. Air pump, inflatable bed. So like that, there's another direction of thought there. But we aim to combine these solutions, couple of these solutions into a single product. Like we had stretchers separately, rubber mat separately, and just a bed separately. So we are looking forward towards combining these into a single product, which is tamper-proof, which cannot be destroyed. Like let's say we have an application in disaster crisis, so no sharp objects can destroy it. So we are looking forward to build a very robust kind of product which can protect the patient in any circumstances and give him emergency assistance. So it's mostly a design innovation. So since it is employed as a car interior modification, we have to consult ARAI and those authorities before going ahead with that. So these are also the thoughts we have to keep in mind while designing our product.
Great. Thank you for sharing some potential future directions. It's good to know what lines you're thinking of, and it's interesting to see how what started as a COVID solution has grown to disaster relief and also overall support for rural India. So it's become a bigger vision, like you said. So thank you for sharing the story. Can you tell us why specifically you want your product to benefit rural India? And I'm bringing this up because the this talk show is specifically geared towards rural India and healthcare
Right.
in India. So, how did you think of this application for your product, and why specifically this application?
Sure. So the problem we are facing, it's not just in the rural India, it's all around the globe.
Hmm.
However, the solutions which are available, which is expensive ambulances or high-fi infrastructures and hospitals, they cater to a very small percentage of the population. Most percentage of the population, which is below poverty line income groups, low income group people, who are not even aware about the technological innovation, who stays in tier two, tier three, or even less small towns and villages, they don't get any facilities, ambulances, or any medical care they need. They are still living 50, 100 years behind. They are not even able to reach the hospitals on time. They have not even seen ambulance in their life. So about more than 60-70% of Indian population comprises of these people. While the healthcare industry is focused on earning money from the rich, this is where we want to target the below poverty line people, because these are the majority of Indian population. They don't have infrastructure, they don't have any inventory meaning medical devices, medicines, or even doctors at times are hesitant to into these deep interiors. So like there are some foundations and associations of doctors who do this generous work, but on a big scale, it's a change is brought by, it has to start somewhere, right? So a product that can scale and impact the bottom of the pyramid, and then one by one it starts to attract attention and attract multiple stakeholders to help out these people. So that's the idea behind it.
Interesting. So you mentioned that one of the challenges of rural India is lack of ambulances, large distances to travel before you can reach a medical facility where there is enough trained staff and infrastructure to even start treating you. So, what are some other challenges that are specific to rural Indian healthcare that you would like to share?
Sure, sure. So I would ask Geetanjali to take this question because she has her family members as doctors in the rural landscape, so she has better idea about this.
Yeah, thank you, Karan. See, when it started, like my family has faced the issue. Okay, since we have the infrastructure, doctors available, and all the equipments available with us, but still we couldn't survive a person, the near one. Okay, so that made us to fall into this, and when we felt like, okay, everything is available around us, so what will happen to the people, those who are not reachable to the hospitals? Okay, so in the situations there were flood. So some of the area from Maharashtra, they were facing the floods, and out of Maharashtra as well, like the Odisha and all. So there was an earthquake too. So in the situation when the health staff who are working continuously 24 by 7 onto it. Like, how will you make our people, to get onto the technology, adapt it, and understand it, and to start working with it, and how it works actually. So there, I guess, Karan, Darshan, and Swapnil, they have come up with a strategy, and we have felt that okay, so we'll reach to the people and we'll make them aware, so that at least the primary consultation or primary health, what we can say, the steps we can take care, you know just understand measuring the oxygen and finding the needs, and then reaching to the hospitals whether they really need the oxygen or not. So all those things were there. So in that case, like, it helped a lot, to reach out to the people and work on it. So
Thanks, Geetanjali. So actually, I'll just sum it up. It's kind of a four-part problem. First is a geographical variation, meaning the kind of emergency ranges differently as the region varies. Like in north, there are floods, as well as in Rajasthan, you can see droughts. There are in some regions there are people are prone to snake and scorpion bites and poison kind of emergencies, while in some regions are prone to accidents, avalanche, landslides. So the kind of emergencies varies from geography. And the other three problems being infrastructure, outreach, and awareness. So awareness meaning superstitions, rumors, fake news. So this is not just a physical or a logistical problem, but this problem has to be dealt in a very holistic way by bringing about awareness as well and educate these people.
Absolutely. Thank you for sharing some of the challenges that vary by geography in rural India. So now that you have at least undertaken part one of your journey of being a healthcare innovator, of being in the healthcare innovation space, what advice would you give other healthcare innovators out there?
Uh, what the advice we would give is same step, very simple. Understand and empathize with the bottom of pyramid people. So you have to innovate further. You have to aim for impact. You don't have to just go for the riches. You have to go for impact. That's all I want to keep this point very simple. Don't worry about money. Don't worry about all these things. Everything comes around. If you know how to create an impact, if you know how to better human lives, everything will come around.
That is lovely. Thank you for sharing, Karan. So now that you've gone through the first few iterations probably of your product and maybe the first few prototypes as well, what does scale mean to your organization? So how do you want to scale maybe in the next 3 years, the next 5 years? Can you shed some light on that?
Sure. So with context to our solution, scale has a two-part definition. First is operational, and second is capital. So I'll ask Swapnil to take the capital part. When we mean operational, meaning for example there's a landslide somewhere in Shimla, Manali, or in some hilly regions. You can't say, and let's say for example the cloudburst in Uttarakhand. It's impossible to send hundreds and five hundreds of ambulances there to rescue people. But then what is locally available? Cars are available everywhere. Vehicles are available everywhere. All you need is to dispatch a set of kits. A kit of 100 kits can easily be sent by one cargo set. Now that can convert 100 ambulances on the spot.
Correct.
So this is one of the definition of scale. Second is with respect to cost, which Swapnil will take the question.
Okay.
Yeah, sure. Thank you, Karan. See, frankly speaking, in India, we have a population of more than 138 crore plus. But what are the number of ambulances? There are 26,000 plus only. So the ratio of actually one ambulance is to then up to 1 lakh means 75,000 to 1 lakh people, and behind those there is only one ambulance. So there are 26,000 ambulances, and we don't want to cry of ambulances. What is ambulance actually? It's a car actually with upgraded some facilities, actually medical facilities. So if we have more than 200 million cars in India, why not to upgrade that car full of only medical facilities equipments. So me, Gitanjali, Darshan, and Karan come together. We, if we 90% resources already we have, why not we give just 10% only? So that 10% part actually we think, and just what we think, that what are the main facilities or the main uh, equipments required for the perfect ambulances that we actually design, and we plan to make a proper kit. And it's it's a cost of ambulances up to the 10 lakh. It started with 7 to 10 lakh, and I don't know, it depends on cardiac ambulances and different types of. But what about the kit? It's less than 10,000. It's up to 10 or 20,000. That's it. So in one kit, in 10 minutes, you can with and through the kit. In 10 minutes, you can convert your cart into the ambulance, and that's it. Simple. It's as simple as it is. You can use a regular car, whichever hatchback, sedan, no doubt. It's all about Indian jugaad. Simple. So this is actually cost effective one. And see,
Thank you.
every question has a different answers and solutions.
Interpretations.
Definitely different solutions, but there is also one jugaad, so it gives actually proper, and we are already better into it.
Thank you for sharing.
Thanks, Swapnil.
Thank
You defined the scale very beautifully here.
you. Yeah, sure.
No, it was very interesting to hear those statistics about how there's such a big gap between the population and the amount of ambulances, and how it's all about Indian Jugaad. And of course, there are ambulances which are very specialized, and hence they need to be equipped with certain infrastructure which is a bigger investment. But at least having these kits in like regions, like you said, like North India, where there are landslides or floods or droughts, then it makes sense to have this kind of cost-effective intervention, which is able to scale larger than probably something that's a little more expensive. Can you tell us a little bit about how you measure impact in your organization?
So, Geetanjali, can you take this question?
So it is as simple as that. The number of cases, the number of kits will be delivering. So we'll be finding out, since we have into this, we have found out the necessities of this kit to implement. Since we have been to the areas where the flood was there, we have been to the areas where the earthquake was there, and the teams were working, and there were the emergencies. So the equation is very simple in that case. So since the pandemic we have seen, and still we are facing the challenges. So there is uncertainty for everything. The way current market and current world is going on. So it is like it is based on the needs and the requirements and the innovations we are doing onto it. The new things will add up into that, and that will cater to the world, and it will help everyone.
Thank you for sharing, Gitanjali. So these are my last two questions for you, and this is geared more towards upcoming entrepreneurs and social entrepreneurs out there. So according to you, what is the difference between entrepreneurship and social entrepreneurship?
This is an interesting question. So, social entrepreneurship kind of comes as a subset inside the big umbrella of entrepreneurship. What is an entrepreneurship? It's you bring something novel to solve a burning need, which creates an impact and value addition to people's lives. It's as simple. Now, there is this pre and post to the pre is that is your innovation, ideation. The other part of entrepreneurship is your business, profitability, scalability, etc. Social entrepreneurship is entrepreneurship without any expectation of profit, without any expectation of return. There is only one expectation, which is impact and betterment of humanity and betterment of society. So that's all. I'm just keeping it quite simple here. So, if people want to aspire in this space, it's the impact you should target. So, like the current startup ecosystem which we see is evolving, it's big valuation and unicorns and scalable profits. So, that is one part of the story. But is it really causing an impact? Big startups are running into loss still after so many years since they have been founded. So are they really being impactful, or it's just hype valuation? That's another question to ponder. But when we think in terms of social entrepreneurship, it's about how many lives are being affected. That's the end of the story. It keeps things simple.
Noted. So it's about caring mainly about impact instead of profit. Is that
Right.
a nutshell? Noted. All right. So my last question for today is there any message you would like to give young change makers like yourself out there?
Only one message. Now is the best time. Indian ecosystems are building at a crazy crazy pace. Startup awareness is coming everywhere. Don't fear the uncertainties. The biggest uncertainty is gone, which is COVID. The second is happening, which is World War III, pondering by Russia. But that's not related to us. So our government is taking very strong efforts to promote entrepreneurs, to promote social impact creators in this space. For example, one of my seniors, he in multiple times he has been in calls with Honorable Modi ji, being appreciated for his social work on multiple occasions. So the ecosystem is better than ever, the support is better than ever, the funding is better than ever. So just take a dive and believe in yourself. That's all.
That is lovely. That is so nice. Gitanjali, Swapnil, anything, any closing thoughts you would like to add?
No, I don't want to add, but yes, I just want to say something which is like, as with reference of war. So, whenever we started actually, so we continuously talking on the, is it COVID is a disease or what? So is it war without weapon? And if it is war without weapon, and which is almost destroy each and every country's ecosystem. So what we supposed to do? We want to work and we want to build a platform already. If next COVID or next something else which comes, next disaster or COVID comes, then we are already ready for to fight and something. So that kind of infrastructure and ecosystem we actually wanted to build into the nation.
Thank you, Swapnil, for sharing. Gitanjali, any last thoughts?
That's it. Karan and Swapnil have said whatever I want to say. So that's it. I'll just say that believe in your potential, and whenever you feel that you need a change, you start thinking on it. So the ways will come up in front of you, and you will make wonders, and that will help to the society and community. So keep little profit for yourself, but yes, contribute more for the nation, contribute more for the society. That's it. I'll say.
I have one more question for Gitanjali.
Yeah.
What is your message to the women entrepreneurs or women aspiring entrepreneurs who are struggling to dream big and actually are aspiring to go big? Some kind words for them as well.
Uh, it's just what I'll say. There is no message. They are perfect at all stages. I can say, though it's a house or they are working in, sitting in the cabin and working, they are doing the wonders. Okay. So where they want to go, they just need to take one step, initiate, and people will come up and join them. And that's how the India is changing, I guess, these days now. So that's
Wow.
all. They just have to come up and say that yeah, I want to do it, and this is what the thought I have, and people will come up and join. India is changing.
Yeah, definitely.
That's it. Thank you,
Yeah.
Karan, for asking this question.
Perfect, perfect.
All right.
Once Cyrus Punawala also said that if you want to be a millionaire, if you must have a solution of million people problem. If you want to be a billionaire, you must have a solution of billion people problem. But the problem is to find out that problem.
All right. So, on that very positive note, I will conclude today's episode. Thank you so much, Team OxyCar, for joining us on this
Thank you.
platform. And we wish you good luck as you scale in your very noble initiative. Thank you.
Thank
Thank
you.
you.
Thank you.
Thank you so
Thank you
much.
so much. Thank you.